Hi everyone, I'm Chin Jimdim, the founder of Zidane Benevolence, a non-profit organization with a mission to work towards the elimination of HIV/AIDS stigma and fight against pediatric HIV/AIDS through disease awareness, disease prevention, professional and child education, strengthening the healthcare and treatment services for children, women, and families. We do operate within the rural communities to help the underserved. Now it's like what we are doing right now, we are trying to respond towards COVID-19 pandemic, even though we are facing a lot of challenges. But before I go into the challenges we are facing, I'll first let you know how we are responding towards COVID-19. So we are responding towards COVID-19 pandemic. How? We are trying to engage vulnerable communities, one. Secondly, reaching the most marginalized, supporting the healthcare systems, continuing education, working through volunteers, sustaining livelihoods, and building resilience. How do we engage in vulnerable communities? Well, one of the most effective ways we can help combat the spread of COVID-19 and limit its impact on fragile health system is by building people's knowledge and awareness. We are promoting preventive action in communities, including practicing good hygiene and physical distancing measures in line with national government guidelines and recognized best practice. From posters to podcasts, we are using a range of channels to reach people with the information they need to stay safe and healthy. In Uganda, for example, we are working closely with the government to share advice, encouraging people to follow the latest guidelines and raising awareness through community announcements and poster campaigns. So these poster campaigns, we are trying at least to change them into our mother tongue, so that at least even those who didn't or who are illiterate or who didn't go to school can be in position at least to get the information well. Secondly, reaching the most marginalized is the second way of engaging into these communities. We do reach the most marginalized because our work is always focused on supporting the most vulnerable people in society. But now, more than ever, it is critical that we take steps to ensure that no one is left behind. We know that crises like this have a disproportionate impact on the most marginalized groups, including people with disabilities, women, children, people living with HIV, and those in prisons, refugee camps, and hard to reach areas. We are committed to ensuring social inclusion and gender equality as part of all our interventions. We are ensuring that all the messages we share are not, as in all the messages we share are not only accurate but also culturally appropriate, gender responsive, are available in local languages, as I told you, and accessible in Wiko district. For example, we are working with volunteers, community representatives, and partner organizations to support deaf people across the country by adapting accurate information into sign language videos and establishing a video call hotline. Now the third way is supporting health systems. Health workers are at increased risk of developing COVID-19 and as well as the danger to their own lives. High rates of illness amongst medical staff reduces the capacity of the healthcare system when it's needed most. Frontline healthcare professionals are already at the heart of our ongoing material, as in the ongoing maternal and newborn health and sexual and reproductive health and rights programs. Now we are also equipping them with the knowledge and skills they need not only to keep themselves safe while delivering essential services, but also to identify symptoms and prevent transmission amongst the communities they serve. We are especially conscious of the increased risk of domestic and gender-based violence during periods of increased violation. So we are training community health workers to handle incidents, refer where needed, and provide psychosocial support. We are also working to anticipate and mitigate against future challenges that will arise after the initial emergency response. We are continuing our work to strengthen health systems and advocate for people's access to essential services as our mission. So, the fourth way how we respond to COVID-19 is by continuing education. Closures around the world means over 1 billion learners are currently out of school, losing access to formal education and opportunities to protection. It provides both children and adolescents, particularly girls, at increased risk. Our volunteers are working in communities to raise awareness of key issues such as gender-based violence and the importance of sharing domestic duties between boys and girls. We are also prioritizing activities which provide mental health and psychosocial support for young people. In the long term, interruption to education can lead to increased levels of underage employment, as some learners never return to school, and the loss of valuable opportunities for young people to develop the skills they need for the future. It's essential that we continue to support as many children as possible to keep learning throughout this crisis. We are enhancing our experience in using innovative approaches to empower marginalized learners, whether reaching thousands of children in our communities, digital technology, or supporting youth to keep up their education in fragile environment to develop novel solutions that keep children learning. National and international volunteers are working remotely to develop material in local languages, which is shared on social media platforms. whereby we also do keep on getting the information which can be in position at least to help those who are in remote communities. So we keep on receiving such information from international volunteers online to help us at least to be in position and get more information to help the underserved. And to ensure our interventions are accessible to all, including those without internet, we are also developing alternative materials and ways of sharing them. As part of the learning projects, volunteers in Buikwe district are working with the government to adapt lessons from the curriculum into content for TV and radio broadcasts, so children can keep up with their lessons while at home. Another way is working through volunteers, where it is safe to do so and in line with national governmental rules. We are continuing to work directly with communities. Our volunteers form deep relationships, build on trust with the people with whom they work. It's through these strong relationships that we are working to tackle the crisis together, ensuring that our response plans are driven by the needs of the people we serve, and using our existing networks to share essential messages. Most of our community and national volunteers have been able to continue their work since the crisis began. It's only one challenge that we do lack: hygiene materials, transport and facilitation funds. The hygiene materials, rural people can't be in position to manage their costs, because in these areas you can find a person who can't even save $1 in a month or 3 months. Yet the hygienic materials are a bit expensive to them, and yet they are the ones to save them because they can't afford even the first treatment of COVID-19 in my country, because it's very expensive. It's all about focusing on prevention, because treatment may work, but prevention is the key. Or the other way around, that is, prevention is better than cure. So it's better at least we focus on how to prevent them from being infected by giving them the relevant information, how to follow the SOPs and the government guidelines. So another way is we do ourselves, we try our level best to find ways of helping them how to sustain their livelihoods. Businesses around the globe are being hit by lockdown measures, supply chain disruptions, and staffing issues. And entrepreneurs, farmers and small medium-sized enterprises are especially vulnerable. We are supporting small businesses owners, young entrepreneurs, and appreciate to reach customers, find alternative income, and provide their products safely. In Lugazi sub-county, that is Buikwe district in Uganda, for instance, we are supporting small business owners to adapt by training them to produce quality soap and sanitizer, which they can sell to local people at fair prices. Through a trainer approach, this knowledge will cascade through communities, so reaching over 1,000 people. We are also supporting small and medium-sized enterprises to look to the future and identify and respond to emerging opportunities. We will focus on resilient recovery efforts, supporting households, businesses, and markets to rebuild and flourish. How do we build resilience? Alongside supporting people to stay safe and overcome the immediate challenges posed by the pandemic, we are continuing our ongoing work to strengthen the essential systems that underpin society, including healthcare, education, communication, infrastructure, and social safety nets. Essential to this is enabling people to understand their rights, support and empowering them to hold governments and other institutions to account. In particular, we are working to safeguard access to services for the most vulnerable and marginalized. We are ensuring that all our programs continue to build communities' resilience, focusing on developing people's capacity through sustainable actions rather than creating dependence. And the last way is by collaborating with our partners. How do we collaborate with our partners? First, we will continue working with other organizations to promote volunteering-based practice, coordinate joint responses, and create the biggest possible impact together. We are exploring opportunities to collaborate with technology and communications partners to deliver information in innovative ways, establish feedback mechanisms, and support primary actors to share content they have developed through our platforms. We recognize that there are times when our partners may be better placed to reach the most vulnerable or isolated groups, and in these cases, we will work to build their capacity to deliver activities. So we are doing all this, but we are facing a lot of challenges, especially the transport means, because now to reach these rural communities, a district can be with a population of 14,000, like Bikwe district, 14,000 people. But when they are all scattered, whereby a neighbor can be in kilometers. So we keep on working because we haven't got the organization van. So you find that when you try to hire, it will be so costly for us, whereby sometimes you may reach some areas when they are a bit muddy and the owner of the vehicle won't allow to exceed, fearing that the vehicle may get stuck in those areas. So we are facing a lot of challenges, but for the transport means we are really down. Because now for such kind of challenges, as you know, with rural communities. Areas of Uganda, especially, the means of transport used, that is cell load transport. Getting access to the health center and community member is not all that easy. Especially, we do what we call door-to-door voluntary counseling and also training. So it's really kind of how can I call it? It's like it makes our work not done following the appropriate time. Sometimes we may say that no, today we are covering up one village, or maybe a week we are covering up a parish, but sometimes we can spend a week on a village. So any call for help we receive from these remote areas, especially in helping the pregnant women, our response is just 20% due to the means of transport we use, especially when we are to attend to such situations for helping the pregnant women, where sometimes they fail to walk up to the health centers. Emergency issues are appalling, where we have to use motorcycles or bicycles to rescue and offer the first treatment, offers aid to those in need of our medical attention. With Wikwe district, it's a central district in Uganda. It has a total area of about 1,209 square kilometers, of which land area is 209 square kilometers, as I've said. The total population is 14,600. 41 is 100. No, it's like the population of Wikwe district is 146,641. Yes. And the district has got only 30 health centers of different levels, where almost 75% have to walk 5 to 6 kilometers to access the treatment. First and foremost, the number or ratio of doctors or health workers to the patients is alarming. It's alarming, where very few doctors work on many patients. This brings in delays at the dispensaries on the appointment days. Some even end up not getting the services as needed in time. And HIV tends to be, or HIV/AIDS tends to be common in all the places in question, basing on the statistics from their different hospitals. This is because the greatest numbers of patients they get are mainly inquiring about this deadly disease. For example, in Kasanda Health Center, I think 3 or 4, where 1,422 clients are on ART, and not all attend because some could not afford public transport fares. So at this point, we want to come in and start monitoring those who prove HIV positive, like for those even who are self-isolated for COVID-19. For the HIV positive people, at least we try and given the ART right from their residence homes. Like for COVID-19, we try to monitor those who are suspected to be COVID-19 positive or victims. So we try at least to deliver the information, the treatments in their home areas, and where needed to transport them to the health centers if the condition requires a proper medical attention. We are calling upon those who would like to give in a hand and donate to our cause, so that we get a van to ease our road transport to deliver our services into our community members. You know, the truth is, life doesn't make any sense without interdependence. We need each other, and the sooner we learn that, the better for us all. When we seek for connection, we restore the world to wholeness. The underserved need joy as we need air. They need love as we need water. And they need each other as we need the earth we share. We have to show them love and restore hope in their lives, because the real festival is the moment when we wipe the tears off from the faces living in despair. So my brothers and sisters, we call upon your support and help us so that we can be in position to get a van. We need a van so that we can continue do our work. We are working in remote areas to help these people who are ignorant about COVID-19 and also HIV.